Hello, and welcome back. We actually have a full day of surgery today, and we're going to help a couple patients in particular who have fibroids and are going to have a myomectomy. And they have all their symptoms. They want to get pregnant in the future. We're going to talk about all of that later on today, about how myomectomy can affect pregnancy going forward after we remove those darn fibroids. So if you're wondering how a myomectomy or the removal of a fibroid from a uterus affects future pregnancies, this video is for you. My name is Eric Schmidt. I'm a board-certified OB-GYN, minimally invasive gynecologic surgeon. I see patients all the time with fibroids, and we're talking about, whether or not it may impact future pregnancies or not. Well, I'm going to kind of walk you through how I have that discussion with my patients in this video. We have a lot of videos on fibroids, in fact, a whole series. So if you want to catch up on exactly what fibroids are, what symptoms they cause, treatment options, but we're mainly talking about someone's decided for a myomectomy and they're wondering how it's going to affect pregnancy going forward, or they had a myomectomy already and they're wondering how it's going to affect it. So a brief overview of what is a myomectomy. Again, like we talked about in the beginning, myomectomy is the removal of the fibroids from the uterus. And this can be done in a number of different ways. Abdominally, with a large cut, like a C-section scar, or potentially an up and down cut on the belly for fibroids. I don't do that very often because I usually do the minimally invasive approach, which would be laparoscopic or robotic assisted laparoscopic through the tiny little incisions. Or it can actually be done hysteroscopically, meaning if a fibroid is located in the center cavity of the uterus, that fibroid can be removed with a little camera that goes up through the vagina up into the cervix. That's called hysteroscopy. And that's the most minimally invasive way to do it, but the fibroids have to be in a particular location, potentially a particular size to do that. So we're really focusing on abdominal myomectomy and laparoscopic myomectomy because a lot of the risks are the same, because for those procedures we actually have to cut into the uterus to remove the fibroids. And so we have to cut and shell out the fibroid and then sew the uterus back together. And why this can potentially impact future pregnancies? Well, it's because when a scar forms, really anywhere in our body, it's not as elastic as the rest of the tissues around it. And so the uterus itself, when a pregnancy is growing, now that stretches quite a bit. It's going from a smaller than a pear-sized or smaller than a pear, the uterus is, but kind of a pear-shaped organ, and it grows all the way to the size of a basketball. And so that scar is stretched out through the pregnancy, and that has different implications, and we'll talk about here in a bit. And so it's actually pretty rare that fibroids affect fertility. And I don't want to have this conversation scare a lot of people into the idea that it's quite common that fibroids cause infertility. It's actually quite rare. But if they're big enough, if they're numerous enough where they're affecting the cavity, it certainly could affect somebody's ability to conceive, or somebody's desiring potential future pregnancies and they are having the symptoms of fibroids, bleeding, pain, dysmenorrhea, then yeah, they might want those fibroids removed because at this point in time, they don't want to try necessarily for pregnancy. Also, myomectomy is perfectly a good option for somebody that maybe doesn't want future pregnancies, but it's an option where someone can save and preserve the most normal anatomy, affect their hormones the least, because even with, well, a lot of people come to me and they say, well, just give me a hysterectomy. I'm like, well, it's not just that. Doing a hysterectomy and saving the ovaries can affect the hormone production a little bit. We talk about that in other videos too. So yes, when it comes to fertility and a myomectomy, actually after the myomectomy, fertility rates are actually pretty good. There's some studies that say maybe 40 to 60% of women are able to conceive within the first year or two. That's actually really good. But again, fertility, the scarring, the distortion of the uterus after, if someone's had large multiple fibroids, it's kind of unpredictable and it might vary from each individual, but for the most part, the uterus usually heals pretty well. So fertility rates are usually pretty good after a myomectomy. Sometimes if my patients have a lot of their fibroids close to where the tubes come into the uterus, I might recommend what's called an HSG once their healing is done after surgery, because that's kind of one of the couple ways that fertility could be affected after a myomectomy. And so that is an option for patients to get if they're experiencing infertility after myomectomy. But again, fertility rates are really good after myomectomy. So let's move on. So someone's had their myomectomy and they talk to their doctor and they're like, okay, when can I try for pregnancy? Can I try right away? Do I have to wait? Well, actually, we do want you to wait a little bit. There's some data to say that the uterus needs a little extra time to heal after a big surgery like this, and the normal layers of the endometrium, you really want to make sure that's good and intact. And so there's a 3 to 6 month wait usually. And for me, it's not one size fits all. It's, how invasive was that myomectomy? Was the myomectomy, was the fibroid more towards the outside of the uterus or pedunculated, just hanging off, where the maybe was didn't even affect the deep myometrium? I might say 3 months for that patient. Or if they have deeper fibroids, multiple fibroids, that are deeper, maybe contacting the endometrial layer, meaning so they've kind of incorporated through the different layers. That's going to be more scarring. I'm probably going to say 6 month recovery before trying for pregnancy for that patient. And this really doesn't usually depend on the surgical approach either. Again, abdominal and laparoscopic, for me, it's the same recommendation. Okay, so let's talk a little bit about the risks when it comes to myomectomy. I think we'll break it down into early pregnancy loss. What are the risks? Are they higher after a myomectomy? They might be a little bit. So miscarriage or early pregnancy loss, in some studies was reported 13 to 30%. Kind of a wide range, but you have to keep in mind that probably in the general population, the early pregnancy loss miscarriage rate is actually probably 10 to 20%. So is it that different? No, but again, if the person that had the myomectomy, we did it for a reason. They had symptoms, there was issues, and so there is a little bit potential increased risk of miscarriage. So the next risk we'll talk about sounds super scary, and it is, but it's super rare. It's called uterine rupture. And when there is a scarring on the uterus, whether that's from a C-section, whether that's from a uterus surgery like a myomectomy, that can, when the uterus is stretched out and that scar is stretched out, and this is usually during labor, because labor is causing a bunch of tension on the muscle walls of the uterus, and it could start to tear apart that old scar. And so that's called a uterine rupture. And it can be actually quite urgent and dangerous for not only baby, but mom. But luckily, it's very rare. When we talked about this, actually, when we talked about TOLAC or VBAC in pregnancy, if someone's had a prior C-section, they have a scar in their uterus too. Usually that scar is a little bit better because it's on a very thin part of the uterus down low. And the thought is if the scars are on the upper, thicker muscle part of the uterus, it may have a higher chance of this uterine rupture during a labor. And the statistics showed this. For a C-section scar and uterine rupture risk is probably 1% or less. Now, if someone had a myomectomy or a surgery where they had a scar in the thicker part of the uterus, their risk probably jumped up to like 6%. And so that's quite a jump in the risk with that upper deep scar of the uterus. Or sometimes there can be placental attachment issues if someone's had prior uterine surgery, where the placenta can abnormally attach and may potentially invade into the uterus muscle. This is, again, very rare. You might have heard of it. Placenta previa or accreta spectrum can happen after a uterine surgery, but we're not going to get into a lot of the details of that today, but that's a potential risk. Okay, so how is this going to affect your pregnancy? So you've had a history of a myomectomy, whether it's abdominal or laparoscopic, and now you're pregnant. Congratulations. And now you're looking to how is this going to affect things? Well, the surgeon who did your myomectomy, whether it's your OB provider or not, should give you a recommendation based on what they saw. Whether it, like I said, if the fibroids are barely into the myometrium, you might be able to potentially have a vaginal delivery. However, if by chance the fibroids are deeper within the uterine muscle and more of that had to be sewn together, you're likely going to be recommended a C-section, and likely a few weeks before your due date, because again, they don't want you to labor, because labor, after the uterus is stretched out, pulling on that scar can be quite dangerous, can cause that uterine rupture risk, which again is a pretty scary situation and requires an urgent C-section delivery most of the time. So yes, your delivery time might be impacted by 3 to 4 weeks or potentially less, depending on what your surgeon tells you, what they saw in surgery, how deep these fibroids invaded into the muscle of the uterus. And likely your doctor might be wanting to get, another growth ultrasound in the third trimester, make sure everything appears normal with baby, uterus, placenta. But that's, for the most part, it shouldn't affect a pregnancy much beyond that. So I think in summary, overall, hopefully a myomectomy shouldn't affect your ability to have a healthy pregnancy and children in the future if you want. And the overall risk of early pregnancy loss isn't much increased. The risk of a uncomplicated pregnancy, it shouldn't change it that much, besides the chance that you'll likely need a C-section. And so I hope this helps. Hope you all enjoyed the video. We'll talk to you soon. One quick plug here. In September, we're doing 30 videos in 30 days. This is a big thing, and we're doing it for a charity. And so if you don't mind, if you like the video, hit subscribe, because we need a certain number of subscribers, actually 10,000, whether we get there or not, to have the fundraiser directly on YouTube. Otherwise, I'll have an external link to go to the GoFundMe page. But we're going to be raising money for gynecologic cancer research, because September is Gynecologic Cancer Awareness Month. And so stay tuned, subscribe, follow along. Thanks for watching.